How to help a patient walk. Before you begin, you must practice hand hygiene. Wash your hands according to the hand hygiene protocol, cleaning underneath your fingernails and washing all the way up to your forearms for at least 30 seconds. After you knock before entering the room, identify and greet the patient. Then, explain the procedure and provide for privacy. Make sure you always lock the bed wheels. Then, raise the side rails before you lower the bed. You want to lower the bed so that the patient's feet, while they're in the dangling position, can touch the floor. Then, raise the head of the bed so that the resident has an easier time sitting up. Then, fan fold the sheets back. Then, shift your patient closer to the side of the bed, being gentle and explaining what you're doing the whole time. Then, transfer your patient into dangling position. Make sure your patient either has shoes or non-skid socks on. Then apply the transfer belt. Make sure while you are applying the transfer belt, you follow all the steps of the application correctly. Double check that the belt is not too tight or too loose. Just loose enough that you can put a hand behind it in between the belt and the person. Critical steps. Adjust bed to lowest position. Apply the transfer belt and apply shoes or non-skid socks. When walking, stand slightly behind and to the side of the person. If they begin to fall, stick your knee out and let them fall onto you, lowering them gently to the floor. Remember to cradle their head so that it doesn't hit the floor and cause any unnecessary injuries. Then call for help and make sure that the resident is okay. Things to remember. Always hold on to the gate belt. If a resident falls, let them fall back on you so that you can lower them to the ground. Make sure that their head is protected from hitting the floor. Keeping mobile can help your resident feel better emotionally and physically if done in the right way. If these guidelines for aiding in a resident fall are not followed, they can result in unnecessary injuries. These injuries are preventable and can be seen as abuse or neglect.